Good morning, guys. Tony Maritato here. So let's talk about the sensation of having one leg longer than the other after a total knee replacement. Now, this is a common situation for patients who have had hip replacements as well. I'm going to tell you that while your surgeon does everything in their power to make sure that both legs are symmetrical, there are some reasons why one leg might feel longer or shorter than the other, or might actually be longer or shorter than the other. Let's break it down into three scenarios. So scenario number one, many of you having your first total knee replacement, you probably have some degenerative changes on the other side. So if that knee on the non-surgical side might be curved out or curved in, we call that varus or valgus, it's going to change the length of the non-surgical knee. So when they're putting in the surgical knee, they want to improve the alignment as much as possible. If they make that knee straight and it used to be curved, now functionally that leg is going to be longer. And I don't think anybody wants them to intentionally shorten the leg to match the curved leg on the other side, because you're probably going to have surgery on the other side as well. When both legs are straight, both legs will probably be symmetrical in length. Now, the other reason why there might be an apparent leg length discrepancy is because if you don't have full knee extension, and many patients after a knee replacement for months don't have full knee extension, there's a little bit of flex, a little bit of bend, even if it's just 2 or 3 degrees, but that little bit of flex is going to cause the replaced side to be functionally shorter than the non-replaced side. Other reasons that might contribute to differences in length could be the way you're walking, the way you're moving, how your hip and ankle have changed following the knee replacement. There are a lot of variables that are going to contribute to the experience of having one leg that's different than the other. And what I would tell you is, while if it's visually a problem, aesthetically it's a problem, that's something that you want to talk to your surgeon about, preferably before you have surgery. But from a functional perspective, what's amazing about the human body is it's highly adaptable. So if you find that you actually do have one leg that is longer, whether it's because of a knee replacement, hip replacement, or some other reason, typically your body will find ways to compensate. And as long as you can adapt to the new ways of movement, it's not going to cause any other problems in the low back or the hips or other areas of the body. So I would tell you that while it may be frustrating, it may be something that is required, something that you can't really change. So rather than stressing yourself out about it, try to look at the bright side of things. Try to look at, well, my knee doesn't hurt anymore. We've eliminated the problems associated with the osteoarthritis. I do have this other thing going on, but I'm still going to make the most of it. And I'm going to get out and I'm going to live my life and do the things that I enjoy doing, because that's why I had the knee replaced, so that I can get out and be more active.